Good morning all. This is Dr. Swetha RD, Consultant Pediatrician and Neonatologist, working at Bannerghatta Road, Bengaluru Hospital. Today we are going to talk about diarrhea and its home management, as we are in the summer months and many of our kids who come to the hospital have diarrhea, and the usual question raised by our parents is, what do we feed them and how do we manage them? This also holds good for other acute illnesses like fever and cough cold, where we have to avoid mainly the dehydration and wait for the self-limiting illness to subside by its own. Diarrhea is passage of loose stools with or without fever and with or without vomiting. As we discussed, our target is to hydrate the kid during the acute illness and to avoid the dehydration, since these illnesses are mostly viral and they are self-limiting in 3 to 5 days of time. How do we hydrate the kid? Most of our kids are breastfed, and please continue to breastfeed the kid. And we use the ideal fluid, that is ORS, where ORS is available in 2 different 1 ml sachets, that is 1 liter sachets and 200 ml sachets. So we use the whole packet to be mixed in the recommended amount of water and to be used within 24 hours. The question raised by most of our patients is, ORS is not palatable and my kid is vomiting after giving it. Yes, it is not tasty, it is not palatable, but the ideal fluid like we recommended is ORS. The child is not going to lose only water. There are salt and sugar composition as well left in the stools. Hence, try to give the ORS in small bits and bits, like 1 spoon over 1 minute and slowly. And we also can measure in the form like 10 to 20 ml per kg over each loose stool. So for every loose stool, if a child is around 10 kgs, I would recommend till the next stool is first. We would say at least around 100 ml to be given to the kids slowly, at least over a period of time. And there are other commercially available ORS like the ORS Tetra packs. Now here comes the huge confusion for most of our patients in the OPD. They say this is ORS L and this is WHO recommended. All that they say, there's a confusion, do not try the Tetra packs. But if it is written as WHO recommended, the plain ORS, yes, we can give the Tetra packs. ORS L is definitely not recommended during the episodes of diarrhea because it's an energy drink. And we also can make a home-based ORS, as in for 1 liter of water, 1 pinch of salt and 8 pinches of sugar, or 1 teaspoon of salt and 6 teaspoons of sugar can be added and made a home-based ORS. Now, other feed what can be given to our kids is rice-based or any cereal-based food. We also recommend the potassium-rich food like the coconut water and the plantains or the green bananas, which can be boiled and mashed and given to them. We also recommend yogurt-rich food, since these are our natural probiotics. We can give it in the form of buttermilk or lassi. Again, lassis should be sugar-free. We don't recommend any high sugar food. So, which are the food to be avoided during the episode of diarrhea or fever spikes? Is those food which are rich in oils, spices and free sugars. These are 3 food which we try to avoid. And the other usual question asked by most of our patients is, do we give the milk or no during the episodes of diarrhea? Not every child with diarrhea have to stop drinking milk, because most of our kids are infants who are predominantly milk fed. Hence, milk amount can be limited if at all the age permits. If not, continue to feed the child. And if there is purging of excessive watery stools or perianal excoriation, we would say to go for the lactose-free diet. But not every kid universally has to be stopped on the milk. The usual next question asked by most of our parents is when to see the doctor. So what we would say is, watch for the danger signs. What are the danger signs? If the child is dull, the urine is less, child is running high grade temperature, there's persistent vomiting, high watery, excessively watery loose stools, excessively crying, these are the main indication for the child to come and seek doctor's help. We would mainly assess on the hydration status of the child to take a call if there's a need of the IV drip. Or we also would recommend on some of the supplementations like zinc, since zinc is going to help us in healing the intestines. The next usual question is the role of antibiotics. We would not recommend antibiotics in the initial stages of diarrhea, as most of the diarrheal episodes, that is 70 to 80% of the diarrheal episodes, are viral. Giving excessive antibiotics is going to kill the normal bacterial flora and can prolong the diarrheal episodes. So I kindly request all the parents not to buy any antibiotics over the counter for diarrheal episodes. The last and the most important step to be taken by most of our parents is the preventive measures. So please maintain good hygiene, and wherever possible, the vaccinations have to be covered, and improve the nutrition of the child, even when the child is not sick, to compensate for their early recovery. Thank you.